Hello, and welcome to this COVID-19 update. My name is Dr. Joe Ebner, and I'm the Chief Medical Officer at Speare Memorial Hospital in Plymouth, New Hampshire. Today's date is Tuesday, May 26th, 2020, and this is a COVID update for the greater Plymouth community in central New Hampshire. As Memorial Day ushers in a new season in central New Hampshire, we now turn our attention across the state as we open up safely our businesses and establishments to more community gatherings safely and more commerce. This change in focus from mitigation to containment will continue to require all of us to do our part. Social distancing and isolation efforts this spring have flattened the curve and has kept all of us safe. COVID-19 continues to be a low transmission across central New Hampshire, but what's happening in the rest of the state? To date, there have been just over 4,000 citizens of New Hampshire confirmed with COVID. There have been about 210 deaths, which is about a 5% death rate in our state. There have been 420 people hospitalized because of COVID in the last 3 months, and this is about a 10%. New Hampshire hospitals remain in a good position with staff, beds, and equipment to care for the citizens of New Hampshire, thanks to you. Our state's hotspots for disease continue to remain along the southern tier of New Hampshire, mainly in areas of assisted living homes, and other areas of community living. It will remain to be seen what residual disease lingers behind, which is why the focus now is on containment, to keep any outbreaks contained across the state. But what's happening more centrally located in the Plymouth community? It's an estimate that the prevalence of COVID among the general population in New Hampshire is about 4%. In the central New Hampshire area, including Plymouth, it's more about 2 to 3%. We've only had a handful of positives in our region over the last month. Although this disease is not widespread here, it is clear that we must remain diligent in our efforts of containment. So what is Speare Hospital doing in response to this new phase? Speare is proceeding cautiously, resuming time-sensitive elective surgeries and procedures, especially those for people who have delayed this care since the beginning of the pandemic. This includes surgeries to alleviate pain, such as gallbladder disease or joint replacements, and procedures to diagnose significant health issues and address problems that are making it difficult for people to function every day. Patients can enter Speare facilities knowing that no one takes the delivery of safe and effective health care more seriously than our doctors, nurses, and staff who have courageously led our institution through this crisis. We continue to engage in vigilant infection prevention measures and have procedures in place to ensure that patients with the virus are cared for in isolation away from other patients needing medical care. Safety starts with cleaning. Our cleaning staff follows specific CDC guidelines to regularly clean and disinfect the facility. Frequently touched surfaces, such as doorknobs, light switches, soap dispensers, and patient care equipment are regularly disinfected. Speare uses a product that has been pre-approved by the U.S. EPA for use during the COVID-19 outbreak. Staff are trained how to apply the product according to the manufacturer's instructions, allowing the sufficient dwell time to effectively disinfect. Our quality assurance program involves using a fluorescent marking spray on touched surfaces to validate thorough cleaning. When the spray is applied, it can only be seen under black light. The marking spray is removed when properly cleaned. Various areas throughout the facility are regularly inspected to ensure compliance. Staff follow strict hand hygiene practices, including changing PPE and washing hands between rooms. It is our goal to provide a clean and sanitary environment so the community can feel safe to seek those necessary services. Our protocols include masking of all people entering our facilities and changing the patient flow to accommodate social distancing. We also offer parking lot testing. All surgical patients will be tested for COVID-19 in our parking lot prior to surgery, and those testing positive will need to delay surgery if at all possible. All care team members are screened daily for illness and will continue to wear surgical masks and protective eyewear, as well as other necessary personal protective equipment at all times when caring for patients. Our physician offices are open for in-person appointments and continue to offer telehealth services for those that meet that criteria. All patients who visit our imaging, our lab, or our physician offices will be screened, including a temperature check. We will continue to limit our visitors, but use electronic devices for family to stay connected with patients and the care team during hospitalization. We will continue to separate those with respiratory illness and possible COVID from others in the hospital. So if you access Speare Hospital or one of its offices, know that you are in a safe location. No one should risk their health and well-being by delaying medical care any longer. We strongly encourage patients with chronic health conditions to resume regular appointments to ensure optimal health. At the bottom of the screen now, you can see, for more information, visit the www.spearehospital.com website. Our public health emergency preparedness partners have also been busy at work, allowing us to open up more and more businesses and functions around the state. Most notably, in the last 2 or 3 weeks, the Department of Public Health, along with the National Guard, offer New Hampshire COVID collecting station at the Armory in Plymouth. This is open 7 days a week. Please access the nh.gov at the bottom of the screen to access the COVID testing form. From there, once you fill that out and submit it, within minutes you'll receive a call from the Department of Public Health with an appointment time at the Armory. If you're having any difficulties accessing this website, please call 211, that number's at the bottom of the screen, to make a collection appointment. This testing will offer a 2 to 3 day turnaround time. Your insurance is billed, and for those of you who do not have insurance, the service is free. You will be notified directly by the Department of Public Health. There's been a lot in the news on antibody testing. Because of the high false positive rate and the low incidence of disease in our region, it is not currently recommended that people be tested for antibodies. But please know that the staff at the hospital and in the laboratory continue to follow this development with the hopes that in the future we'll have a more reliable test to offer our community. So what can you do now to keep yourself safe? Please continue to wash your hands. The majority of infections comes from hand-to-face contact. Avoid touching your face. The third thing is to mask. This cloth mask covering will do 2 things. It will decrease the asymptomatic spread in our community and also prevent you from touching your face. Lastly, maintain a social distance of 6 feet and avoid crowded locations. If you are feeling mildly ill, you can either work through the state collection site, as I mentioned earlier in this discussion, or give your doctor a call and ask for COVID testing. If you are feeling severely ill and feel you need to be seen, please call your physician's office and they can arrange an appointment for you, including COVID testing. If you feel it is emergent, such as shortness of breath, difficulty breathing, you can always come safely to the hospital where you'll be triaged, cared for, and tested. If you have confusion about what you should do or where to call with your health, please see the helpline at the bottom of the screen, 603-238-6464. This line is staffed 24/7 by a nurse at the hospital who can help direct you to where you should seek care. As the state of New Hampshire relaxes our social distancing for the summer months to come, consider the following. First, limit your gathering size. Until we have the clear go-ahead to gather in large groups, continue to meet in small groups. Wear masks whenever you're in public places. Wash hands often. It's been refreshing to see that both in and out of various stores and restaurants, you have access to alcohol-based sanitation stations to wash your hands. When you're in those places of business, socially distance as best you can, 6 feet or more from those around you. Follow the instructions of the establishments. They're working closely with the State Department of Public Health to keep all of the staff that work at those locations and the visitors safe. Our healthcare system is ready to accept a potential second wave of COVID later this summer if it arises. The state has additional testing capacity so that we can test a more broad group of people if the needs arise, and our public health has beefed up its resources for contact tracing so that we can hunt down people who may have been exposed. We continue to look for a possible future vaccine. For more timely and accurate information, see the websites both at Mid-State Health Center or at Speare Memorial Hospital, where you'll be directed to more sites from there, such as the CDC. Thank you for your ongoing support of our local healthcare workers. What we need now is your trust. Do not be afraid, but be well.